Hi, my name is Daneshvar. I'm the Chief of Brain Injury Rehabilitation at Spaulding Rehabilitation. I'm also the Associate Professor at Harvard Medical School and the Co-Director of Sport Concussion at Master John Brigham. My dissertation was actually the first dissertation in history to study CTE. The CTE has been around since 1928, and the fact that it wasn't until the 2000s that the first CTE dissertation was published was really remarkable, but shows how little focus had been paid to this disease process. Your brain has the consistency of like Jello, and it moves like Jello if you were to hit it. If you had a bowl of Jello in front of you, you were to hit it, it would vibrate back and forth. But if you looked at it after it settled down, you wouldn't be able to see any problems in it. But the blood vessels have a different consistency than that Jello-like brain. So the blood vessels are stiffer. If you put them inside that bowl of Jello and hit it, it would jiggle back and forth, but the Jello would move and the blood vessels would move a little differently. And when it all settled back down, you might see small cracks where the Jello's touching those blood vessels. And that's what we see when we look at the brains of individuals who get repeated head impact exposures, is that there's damage around the blood vessels where the two interfere with one another. And we used to think about the brain as like it actually hitting the wall of the skull and then that causing the injury. But we actually know that the stretch of the brain, that actually causes more damage, or a significant proportion of the damage when we're talking about concussion and when we're talking about repeated traumatic brain injuries. It doesn't need to move far enough for the brain to hit the skull for there to be sufficient damage to cause problems later in life, including concussion and including CTE later. In the medium term, what we end up seeing are problems like ADHD or other focus, attention, concentration problems. And then years to decades later, we can find that after thousands of these repeated head impacts, some individuals develop CTE or other neurodegenerative diseases. Most neurodegenerative diseases, like Alzheimer's or Parkinson's, we don't know precisely what causes them for the vast majority of people. But CTE, we know what the cause is. We know it's these repeated traumatic brain injuries. And so from a public health, public advocacy side of things, if we can better understand and quantify the factors that are responsible for the disease, we can prevent the disease altogether by understanding what's going on in their brain. And so when we're talking to coaches, when we're talking to parents, when we're talking to athletes, what we need to remember is that anything we can do to limit those total number of hits to the head, that's going to be what prevents CTE later in life. And so one of the easiest ways to do this is to change the way we practice. Over 60% of the head impacts that occur in football occur in practice. So without affecting a single minute of game time, we can fundamentally reduce people's risk of developing CTE in life. Second thing we can do, another simple thing to do, is by starting people later. In my career now, a large portion of my practice involves treating NFL players. And when I've worked with these hundreds of NFL players, they haven't told me that the reason they were professional football players was because they started playing football at 8. In fact, many, I would say the majority of these NFL players, they didn't start playing until later, many of which didn't start playing until high school. So if these NFL players can play football at the most elite level and not have to start playing until later, it's very hard to convince me that an 8-year-old playing football is necessary, integral to their development as a football player. So, but what I do know based on the data is that if they start playing later, they're going to have a lower risk of developing CTE because we've limited the total cumulative force to the head they've experienced substantially. Individuals who have experienced traumatic brain injury, they're at higher risk of dying by suicide than the general population. Because having damage to your brain, the parts of your brain that are responsible for impulse control, decision-making, mood like depression, having problems with those parts of the brain, that's not going to help you make better decisions. That's not going to help you be more resilient to the stresses of life. And so suicide is complex and multifactorial, but we know that having damage to the brain isn't going to help. I was an athlete in high school and college myself. I know that we want to be out there helping our teams and winning our matches, our games. And so many times athletes are not going to come forward to say when they're struggling with an issue. And so it's important then for a coach, for an adult in the room to take a look and say, is this athlete different than I'd expect them to be? And in many cases, because these brain problems are invisible injuries, it's easy to chalk them up to someone having attitude today or someone having problems. But it's important to try to look past that and think about, is this a brain issue? And does this person need to be evaluated just to make sure it's not? Because your brain's responsible for everything, if you have a brain injury, you're not going to be working at your best. So think about it from a sports perspective. If there's an injury to your brain, it's going to affect your reaction time. It's going to affect your proprioception, or your ability to balance and know where you are in space. It's going to affect your processing speed. All of these things are what make us elite athletes. It's not just our muscles, it's our brain controlling our muscles. And so if you're thinking about it just in terms of wins and losses, if your athlete has a brain injury, not giving them the proper time to recover is going to ensure that they're not playing at their best, and you're more likely to get a loss, rather than sitting them, getting them evaluated, getting them properly treated. They're going to come back faster. They're going to be better.